is leading to a higher health risk for patients even 2 years after getting the virus. That's the findings of a first-of-its-kind study by Washington University. So the 2-year study compared health outcomes of over 138,000 patients who had been affected with the virus to nearly 6 million non-infected people. Researchers tracked the development of over 80 health conditions associated with long COVID, finding people who have been infected with COVID have a higher risk of developing health issues like diabetes, blood clots, heart failure, and lung conditions. People who are hospitalized have even higher risk.
In the group that was not hospitalized, we saw still elevated risk or persistently elevated risk for 31% of the problems that we looked at, and we looked at 80 problems. For the people who were hospitalized, that figure or that number went up to 65%. So nearly 2/3 of the problems that we looked at still manifested with increased risks 2 years after the infection in people who were initially hospitalized for it.
Well, researchers also found these post-infection conditions led to loss of about 80 healthy life years per 1,000 non-hospitalized patients and 643 lost years per 1,000 patients for those who were hospitalized.